Welcome to Lesson 2 of Section 3 of Hope. I hope the previous lesson helped you to see God and His love and grace toward those with infirmities and trauma more clearly. As we have already identified in previous lessons, the first step in solving any problem is admitting that we have one and defining it well. However, even that is just a place to start. We also have to know the extent and seriousness of the problems we are facing and to know what kind of help or treatment we may specifically need to address them. If I have emotional pain, I will also need to understand what my pain is caused by, where it is located, and how severe the problem might be. If I am emotionally injured, I will need to understand whether the injury is similar to stubbing my toe, painful but likely to heal soon on its own, or equivalent to being in a head-on collision resulting in multiple severe and life-altering injuries, requiring more drastic treatment and long-term recovery. So to help you better identify the extent of your emotional wounds, core trauma, and pain, and how they may be affecting you, in the next few slides, I'm going to lead you through some common symptoms that affect people with emotional pain in a variety of areas of life. Later, I will explain more fully why these symptoms show up in different areas the way they do, and why, although that seems like bad news, it can actually be good news in the healing process. As I review these, follow along in your course guide and place a check mark next to those items that apply to you to help you better understand the extent of the problem or pain or trauma you are facing. Here are some common symptoms of core trauma. Let's start with the physical symptoms. Panic attacks, problems with sleep, too much or too little, fatigue, weight and appetite extremes, gastrointestinal problems, loss of sex drive or desire, headaches, physical aches, pains, or symptoms with no known or apparent cause, muscle tension, bodily stress, tightness, twitching, shaking, tremors for no known physical reason, back or neck pain with no known cause, joint pain and autoimmune symptoms, and fibromyalgia, which is a condition where people feel pain in one or more parts of their bodies for no known reason. Emotional symptoms: frequent or ongoing depression, frequent sadness or crying, frequent sense of anxiety, restlessness, or a sense of doom, frequent outbursts or feelings of anger, frequent feelings of guilt, frequent feelings of helplessness or hopelessness, feelings of emotional numbness, a frequent sense of fear, frequent feelings of powerlessness, frequent feeling easily overwhelmed, frequently feeling out of control, frequent feelings of being easily embarrassed, frequent feelings or fears of rejection or abandonment from people close to you, frequent feelings of insecurities, inadequacy, incompetence, or unworthiness, or never feeling good enough, frequent difficulty concentrating or focusing, rapid shifts in mood, or frequent irritability. And here are some behavioral symptoms that are common for people with core trauma. Addictive behavior, or a feeling of not being able to control or stop the need or use of alcohol, prescription or illicit drugs, sex, pornography, masturbation, food, spending, gambling, gaming, shopping, etc. Compulsive behavior, feeling compelled to do things that you can't seem to help or keep doing in spite of attempts to stop or change. Impulsive behavior, frequently doing or saying things spur of the moment that you later regret, repeatedly making poor decisions that you do not think through or consider the consequences. Lifestyle extremes, trying to keep things meticulously clean and ordered or living in complete chaos. Difficulty letting go or having fun, even when with friends. Emotionally overreacting to change, especially minor or unexpected change. Frequent nightmares, recurring dreams, or anxious dreams. Here also are some thought life and attitude symptoms common to people with core trauma. Repeated or consistent thoughts or fantasies of hurting yourself, suicide, or hurting another. consistently critical or negative thoughts towards yourself or others, having an ongoing attitude of cynicism and frequent use of sarcasm, having frequent negative thoughts and thoughts of self-condemnation or guilt, being consistently hard on yourself or others, difficulty receiving compliments and having a low sense of self-esteem, a tendency to blame or get angry at others or circumstances as the cause of most of your ongoing struggles or problems, a sense of being uniquely different than others or bad somehow as a person, a frequent sense of shame and feelings of worthlessness or unworthiness, a frequent sense of meaninglessness or purposelessness in life, oversensitivity to issues of injustice and to a tendency to feel easily mistreated, a low sense of competence and confidence in your abilities or accomplishments, frequent feelings of being fake or of being a hypocrite or feeling a constant need to perform or earn your worth from others, struggles with unwanted sexual behaviors, identity, or attractions, a distorted body image, thinking you're ugly when others say you're attractive, thinking you're fat when others think you're normal. And finally, some relationship symptoms that are common for people struggling with core trauma. Difficulty trusting others even when there is no evidence of untrustworthiness, or being quick to assume that others have bad motives. Difficulty forming close relationships, feeling close to others, or establishing or maintaining intimacy. Difficulty saying no and setting limits with others and feeling frequently taken advantage of by others. Frequently exercising poor judgment in relationships, consistently getting into relationships with others who hurt, use you, mistreat you, or where you feel taken advantage of. Exploiting or attempting to control others in relationships through physical means or emotional manipulation. Frequent feelings of jealousy toward others or with significant others. Frequent sense of neediness and insecurity in relationships. A tendency to be over-involved in other people's crises and problems. A tendency to create or avoid conflict, but not be able to deal with it very well. Poor communication skills or ability to listen, empathize, or make reasonable requests for yourself. Repeating relationship patterns where you are abandoned, hurt, or rejected, do the hurting, abandoning, or rejecting, or feel easily abandoned, hurt, or rejected, even when it might not be the case. If you haven't already, take a moment now to go back through the list of symptoms and check the box of the symptoms in your note-taking guide that you can identify within your life right now. Having one of the above symptoms alone or experiencing some of these symptoms on occasion does not mean that you have significant unresolved emotional wounds or core trauma or pain. Events are different from patterns. However, if you do identify with multiple symptoms and in more than one category consistently, it is likely that these are connected with the emotional wounds and core trauma that you have and experiences from your past. However, ruling out physical causes of any of these symptoms is always a priority. So if you suspect any physical causes, please check with your doctor. Physical causes of emotional symptoms can include hormonal changes, thyroid issues, Lyme disease, neurological issues, and more. Please consult with your doctor to determine if you have any underlying or contributing physical causes to any of these symptoms. I hope that after reading through this list and completing this exercise, you are not feeling overwhelmed. But if you checked multiple boxes, it is possible you might be. If you are, please take a break to give yourself some time to process your thoughts and feelings as you consider the different symptoms you have been facing. Having multiple symptoms does not mean things are hopeless. It simply means that trauma has found its way into different aspects of your life. But now that you know that trauma is the cause, there are many things you can do, and God is waiting to do in your life to help you recover. The good news is that now that you have begun to identify more of the details of your symptoms and the extent and possible locations of them, you can begin to understand the common causes of many emotional infirmities, which we will explore next. In our next lesson, we will look at how and why trauma affects your physical and mental health. I'll see you in the next lesson.